cases, the highest in over 4 months. This brings the total caseload to more than 574,000 infections, more than 37,000 of which are still active. 42 more patients died of the virus in the past 24 hours, bringing the death toll to more than 12,200. Total recoveries, meanwhile, have surpassed 524,800 mark, with 293 new recoveries or survivors reported today. Globally, the case tally for COVID-19 cases is now at 113 million, with over 2.5 million deaths. This is according to Johns Hopkins University. Now, to help us make sense of these numbers, we have with us Octa research member Professor Guido David. Sir?
Yes, hi, good evening, Riza.
Good evening, sir. Today, it's almost 3,000 new cases that were recorded. What could be the reason as to the sudden surge of cases, sir?
Well, actually, since we've been tracking this already for a few days now, I mean, this increase that's happening in Metro Manila, it's not really that surprising because the reproduction number in Metro Manila has increased to about 1.43. And this means that the cases will continue going up. And in fact, the reproduction number is still increasing. So it means that even the rate of increase is going up. And that means we can expect to see more and more cases unless we curb this increase. But as we have seen in Cebu, it's actually not that easy to curb this increase once it starts happening. This is what we have been essentially warning about since the holidays, since last December. And so far, we've managed to avoid this kind of increase, but now it's happening. And we know that it's definitely happening right now because all indicators are increasing. Right now, positivity rate, for example, is up to 6% in Metro Manila. So we were, hovering, or we were keeping it at 4% for several months. And the other indicators, the attack rate has also gone up.
Professor David, this is the highest in 4 months. Should the public be alarmed with this spike?
Yes, if they are not alarmed, well, the government should be alarmed because it's not that it's just the highest in 4 months, but the rate of increase is very fast. And if we do not curb this, then our projections show that we will reach the values that we saw in August in about 1 month. Before the end of March, we will be at that level. We'll be at around more than 2,000 cases per day in Metro Manila.
Sir, which areas have been seeing a large spike in cases?
Well, in NCR, it would be Pasay is of course seeing the largest increase. In fact, if we rank the LGUs in NCR, it's Quezon City with the most number of cases still, but Pasay is already number 2. Manila is also seeing an increase, and Makati is also seeing an increase. And then some of the other LGUs like Quezon City is also seeing an increase, but the rate of increase is a little less. But the rate of increase in these 3 LGUs I mentioned, Pasay, Manila, and Makati, the rate of increase is actually significant, and we are concerned about that.
Sir, how could this affect the country's vaccine rollout, considering that we are expecting, of course, Sinovac shots to be arriving? Do you think this would tame the spike?
Well, in terms of the rollout, in terms of affecting it or delaying it, I don't think it will because we're planning to have the vaccine rollout starting this week, starting Monday. And the hospitals are not full yet. So, in fact, the hospital occupancy in NCR is only at 36%. It means that it will take some time before hospitals get filled up. Maybe not even 1 month. Maybe it will take some time if the surge or the increase continues. But in terms of affecting the numbers in a good way, we don't see that happening yet either because we are just about to start the rollout. and the effectivity of the vaccines will not factor in that much after just the first shot. So it's only after the second shot, the booster shot, that we can expect the vaccines to become more effective. But that won't happen until, let's say, about 1 month or even 2 months from now, from this week. So it means that the numbers will not decrease that much due to the vaccine immediately. But well, hopefully we can curb this pandemic, this surge in NCR, not using the vaccine, but using just basic measures like social distancing and avoid going out, avoiding social gatherings, etc.
Sir, with that being said, what's your reaction on the uniform, the travel protocols?
Well, it's concerning. I mean, we're not really against people being allowed to travel, but we must have some level of safety measures in place, especially now that a surge is happening. I mean, even if the surge is not happening in Metro Manila and Cebu, we'd still be concerned. But now we are more concerned because the surge is happening, and this could have consequences on areas where the number of cases is low right now. For example, Davao City is improving. Iloilo and Bacolod, they have low case counts. So, if they have tourists going in or out of those areas and they manage to bring the virus in there, then it could start another surge in those areas. In Metro Manila, the surge is already happening, so we might not be affected that much. But still, especially since there may be variants of concern in different areas. For example, in Cebu, it may be, we're not sure if it's a different variant, but it's concerning if these are allowed to spread in other areas.
Well, thank you as always, Professor David, for joining us. Now this just crossing our wires, the palace confirms that the Philippines is expecting to receive some 525,000 doses of AstraZeneca vaccines from the COVAX facility by Monday. Presidential spokesperson Harry Roque said the vaccines forms part of the 44 million doses of shots from COVAX. Roque said the vaccines are expected to arrive around noontime on Monday. AstraZeneca is among the 3 manufacturers that have secured emergency use approval from the FDA.
Nagpapasalamat po tayo kay Ambassador Cruz ng Inglaterra dahil ang kanyang intercession po ang naging dahilan kung bakit napabilis po ang pagdating ng AstraZeneca sa Pilipinas.
Now first on One News, Marikina City Mayor Marcy Teodoro confirms that some city residents will be among the recipients of the country's first vaccines. Speaking to us this afternoon, Teodoro says the LGU has already prepared and coordinated with the IATF on who among their residents will be getting the shots. The 600,000 donated Sinovac doses arriving tomorrow will be stored in a cold storage facility in Marikina.
We have been coordinating with IATF, the vaccine cluster, for the allocation that the city will be receiving. We are preparing now, and we have prepared some of the lifting, particularly not only those healthcare frontliners, but more importantly, our economic frontliners.
Teodoro also says they are expecting a seamless transportation of the vaccines, which will take about 40 minutes. The Marikina mayor clarifies that the LGU will only be providing logistical support, traffic management, and security of the facility. As of this afternoon, he says there is still no information on how long the doses will be kept in the city's cold storage.
We don't have really an idea on the side of the local government how long it will be kept in the facility, but it will be deployed as soon as time possible.
Now here are other stories we're watching. The Tourism Department welcomes the approval of uniform travel protocols for all local governments. In a statement, the agency said the IATF resolution will encourage domestic travel and promote local tourism, which will aid economic recovery in the industry. Now, beginning Monday, all tourist sites in Davao City will be reopened in celebration of the city's founding anniversary. The Island Garden or the Island Garden City of Samal or Igacos will also be accepting tourists at a limited capacity starting March 1st. And Makati residents are saying no to free COVID-19 vaccines from the city government. Over Facebook, the LGU announced earlier today its registration for free Sinovac doses. But residents rejected the vaccination program via the comment section, saying they prefer other brands. And we'll be back with more stories after the break. Keep it here on One News. You're still watching One News Now. I'm Riza Diaz. The NBI has begun its probe into the misencounter incident between the Philippine National Police and the Philippine Drug Enforcement Agency. Let's get more updates on the investigation. We have Ryan Ang reporting live from UN Avenue, Manila. Ryan, what's the latest?
Risa, new footage show the actual shooting during the misencounter between the Philippine Drug Enforcement Agency and the Quezon City Police District. This was caught from a CCTV footage at a nearby fast food restaurant. The video, we can see a gunfight between the two groups. This was actually the start of the shootout between agents of PDEA and elements of QCPD last February 24. Based on the initial investigation of the NBI, the bypass operation was initially set at Quiapo, Manila, but the target moved the transaction to Litex, Quezon City. And while the agents are traveling towards the location, their car overheated, prompting them to stop at a nearby parking area of a fast food chain at San Antonio corner Commonwealth Avenue. In this video that News 5 got from a source, we can see the hood of the white car up while they are fixing the car. Soon, a group of men led by a man on a black shirt approached them. The group pointed their guns to the passengers of the car and a gunfight ensued. Allegedly, a man on the PDEA side got hit first, followed by the armed men in civilian clothes. In the end, the armed group were identified as policemen from QCPD. PDEA agents even got to call for backup, but were allegedly overpowered by policemen who arrived at the scene. Some pictures show that PDEA agents were made to lie down face first on the ground. PDEA agents even claimed that upon their backup's arrival, the reconnaissance team were arrested and physically hurt. Risa, the NBI has continued their investigation on the crime scene this morning. The two vehicles supposedly involved in the crime were already brought to NBI headquarters here in Taft Avenue this afternoon. Risa.
Thank you for that report. That was Ryan Ang reporting live from Manila. Now, the family of a police officer who died in the shootout between the PNP and PDEA is seeking answers as to what happened during the encounter last Wednesday. Marian Enriquez with the story.
16 gunshot wounds. This had been the fate of 32-year-old Police Corporal Lauro de Guzman following the shootout with PDEA agents in Quezon City on Wednesday. His wife, Andrea, is still in shock about what happened to his husband.
Napakasakit nung nangyari na parang sobrang pinatay niya sa parang kalaban-laban. Na sobrang daming balang inano sa kanya.
Lauro grew up in San Miguel, Bulacan. He and Andrea were college friends. They tied the knot in 2017, shortly after Lauro graduated under the PNP-PDEA Sandigan class of 2015. He then worked in Batasan Police Station 6 before being transferred to the Quezon City District Special Operations Unit last December. Andrea says the last time they were together was during Valentine's Day. Their next meeting would have been last Thursday. She says Laura was able to send text messages prior to the shootout.
Ang pinakamamimiss ko talaga sa kanya yung pagiging masayahin niya. Napakamasayahin na tao. Napakamapagmahal na asawa, mapagmahal na anak.
Laura's mother, Yolanda, is also devastated by the loss of her youngest child and only son. She says they did not know Laura worked on anti-drug operations.
Nag-iisa na ba? Nakahirap sa amin. Wala na kaming anak na lalaki. Hindi namin mapaniwalaan na napasok na pala niya yung ganong trabaho na mabigat. Kala namin pahuli-huli lang ng may sabong.
Laura's family is now seeking justice over what happened in Quezon City as NBI begins its investigation on the incident. Laura's burial is scheduled on Wednesday, March 3. For News 5, Marian Enriquez, we are One News.
For more updates, visit News 5, the Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. We are One News.